The next thing we're going to do is a stretch and manual therapy technique for our hamstrings. So what we want to use with manual therapy is that manual therapy is going to be a lot more effective than just doing static stretching to be able to go and help release muscles and improve flexibility quickly, safely, and effectively. So what we're going to do is we're going to lay down on our back for the hamstrings, and what we're going to do is we're going to bring one knee about a 90-degree angle with your body laying flat on the floor. And you're going to take your hands and you're going to feel the guitar strings, basically your two big hamstring tendons. You should feel them right here. They're very pronounced, so you should be able to go and feel those. Then from this position, you're going to lay down and pull the toe towards you. So you want to have the entire part of the back of your leg on tension. So you don't want to let the toe do this. So you want all the fascia, you want all the muscles on tension. So from this is that instead of just sitting and holding in a stretch, what we're going to do is we're going to use self-release techniques. We're going to use the back of my fingers kind of like I'm cupping, so it looks kind of like this, like I'm curling my fingers into the back of my hamstring. You want to be very careful that you have short nails, or else you're going to leave your leg a bloody mess. So make sure your nails are very pared down, because you'll be digging in with the tops of the fingers. If you have long nails, you're going to be slightly or very uncomfortable. You look up and you're, why is my leg bleeding? So pare down those nails. So we're going to pull the toe up towards us, so you got a nice tension, so you got a little shake there. And I'm going to take one hand. I'm going to start with my right hand, and I'm going to do self-massage strokes from the knee down to the glute. So your hamstring runs from behind the knee, actually below the knee, all the way down to the top of the bottom of the pelvis. So it's called our ischial tuberosity. So it actually runs all the way into our butt, and you can kind of feel the bony process if you kind of push there. And that's where we have to be able to go and massage all the way down to, if we can. If you can't quite get there, if you're not quite strong enough to do it, don't worry about it. A lot of this will help, but we want to be able to ideally get down that low. So we pull the toe up. Now I'm just going to dig in on the outside, and I can feel that that's very sensitive right there. As I pull, going down, and you can stop if your hands get tired, pull it back and go down again. That's called approximation, a little massage therapy technique. Ideally, we can go down in one stroke, and as you get better, your hands will get stronger. So again, you can see that my hands are really working. So we want to do about 3 strokes going down on the outside of the leg. So again, I start off behind the knee again, and then rolling down the bottom back of the knee, the outside of the leg. Again, a nice slow stroke. You want to be able to be skin on skin. That creates friction, which helps the muscle lengthen more. So again, I do that 3 times on the outside. I'm going to go through 3 times in the middle. And if I'm strong enough, you might be able to try to, instead of holding with both hands, you can try to use both hands as well. If you want to get a little bit aggressive too. So going down. If you're going to do both hands, keep your fingers together. And then what you can do is do the inside of the leg, of the hamstring. That opposite hand, and that feels pretty sore a little bit on me. So after you go through 3 strokes each side, go ahead and switch sides, do it again. And then if you can come back and do 2 to 3 repetitions on each side. That should be sufficient to be able to go and release the hamstrings. Now, what you should see after is that once you've released them and you stand up, you should feel like your pelvis is tipped forward and you feel like you're really arching your back. You know, kind of like, you know, you have like Donald Duck butt. So the idea is that the hamstrings have released the point at which your hamstrings, the hamstrings attach to the top of your pelvis, if they're tight, they kind of pull your pelvis backwards and kind of tilt your body downward, and it kind of pulls that. So when you stretch it out, the pelvis tips forward, and you kind of get a little bit more of an arch in your low back, and that's how you know you did the stretch properly, because you get a nice release there, and you'll feel that pelvis has tipped, kind of like, instead of being here, you'll feel the pelvis is tipped forward like this, and we have an arch in our back. And that is the supine hamstring stretch and self-massage.